Well, hey, I wish we could have done this in person because I feel like it would have been a lot more entertaining. I don't know if you can hear those fire guys, they might be entertaining enough. But, anyways, I chose to do patient safety culture because I had never heard of that term and I didn't know what it was. And I was actually kind of nervous at first uh, doing research about this because it was all new to me. But after my research, I have it's been really interesting to see. I'm going to talk in the perspective of Johnston County because that's what I know. That's the organization I work for. Um, so you'll hear me reference Johnston County a bunch during this, but I have been able to see where like policies and procedures that they put into place and the way we do things around here is for a reason. It's not just, people sitting around making up stuff for us to do or making up policies just because. Um, it's been intentional and it is centered around this whole idea of safety culture that, like I said, I'd never heard of. I titled this just safety culture at first, not just patient safety, because I feel like there's two branches of safety culture, and we'll get into that in a little bit. I thought of culture, um, you know, I just thought of like certain social groups, um, different nationalities, different spiritual beliefs, stuff like that. Um, but the general definitions, I found three general definitions of culture, which I found that in this safety culture, they just kind of combined all of these. But the third I liked the best, and I'll read those to you. The first one is a set of shared attitudes, values, goals, and practices that characterize an institution or organization. The second is a set of values, conventions, or social practices associated with a particular field, activity, or societal characteristic. And the third is the integrated pattern of human knowledge, belief, and behavior that depends upon the capacity of learning and transmitting knowledge to succeeding generations, which I feel like that one applied, or it kind of sparked my interest better because um, I don't know that I'll use this methodology to go teach in a classroom setting, but I know that it'll help me at least as a preceptor because whenever you get somebody new, especially some young, impressionable uh, cadet, EMT, paramedic, whatever, um, you do have to integrate. You are, whether you want to or not, whether you mean to or not, you are integrating your culture into them. You are representing whatever agency you work for. So you may be their first impression of this agency. So are you not careful? Are you reckless? Or do you not care? That kind of sets the tone for things. The organization. Are you happy? Do you like coming to work? Stuff like that. So you are integrating your behavior, your beliefs, your attitude to that new person, and you're transmitting that knowledge to succeeding generations. You, as a preceptor, you are passing down that knowledge. That's the whole reason of being a preceptor is, passing on setting the tone for the atmosphere of EMS and of your organization. Are you one that really wants to be respected as EMS? Do you care what people think? I know I have a hard time with that because I don't like being seen as the redheaded stepchild. Um, I want to go in and those nurses respect me and say, she's a dang good medic. Um, I want to be taken serious, and I think that's where an organization of Johnson County, I'm proud to work for Johnson County. I feel like they've been very proactive. They are up to date on their research and their interventions and equipment. And we'll talk about that in a little bit. But I just feel like the culture that you portray and you display to new folks is, that really sets the tone for your organization and for your career in EMS in general. So safety culture, the definition of actual safety culture is a collection of core values that provide a frame of reference for leadership and workers and influence shared beliefs, practices, rituals, norms, and behaviors related to safety. A positive safety culture is expected to result in decreased risk, fewer errors, adverse events, and other negative safety outcomes. And that's really what we're talking about today, is whether you have a positive safety culture or a negative safety culture, because we're trying to shift that atmosphere of negativity and of reprimand for just human errors. So we'll talk about that in a minute. So what I was wondering was, how do you measure this? The more I researched, the more I learned that your safety culture, your culture in general in your organization, it can be felt. It's a moral, you can feel the morale within your organization. But I've learned that it's challenging to measure, because when you're talking about safety culture, all throughout this research, it starts with leadership. But you have to do these surveys, and your results are based on the honesty of the employees, the honesty of the frontline workers, whether it's, questions about leadership and how things are run, or you're questioned about near misses and mistakes that you've made. Number one of those, the culture is, you have to set a culture of integrity. So that there is, are people going to be honest about their mistakes that they make or their near misses? But you have a lot at stake. You have your job, you have your reputation. So you have to create an atmosphere that people don't feel like, because they made a mistake, that they're just automatically going to be fired. But we have to start with surveys, because that's something tangible, that's data that's collected, that can be measured. But you will see effects on physical safety, whether it's negative effects or positive effects, whether what you're doing is right, whether you are minimizing risk. But also, in hospitals, they're seeing financial increase from this. They're getting reimbursed for improvements in their risk, in infection rates, and anything that you can think of. So we have to start with data collection. So we start with these things called SOPs, surveys on patient safety. They raise staff awareness about patient safety. They diagnose and assess the current status of patient safety culture. They identify strengths and areas for patient safety culture improvement. They examine trends in patient safety culture changes over time, and they evaluate the cultural impacts of patient safety initiatives and interventions. So is the policies and procedures that you put in place, are they working or are they not? Are they helping with the risk or are they not? And you can find these surveys on the AHRQ website. They use these SOPs surveys, and just testing in general, they can identify the strengths and weaknesses in these areas. Areas like teamwork, staffing, compliance, training skills, non-punitive response to errors, handoffs. I saw where they're in the hospital, they're using a new method, an SBAR method for handoffs. And SBAR stands for Situation, Background, Assessment, and Recommendation. So they have, I don't know if anybody noticed, a couple years ago when we started taking patients into James C. Smithfield, the nurses it was mandatory for them to do bedside handoffs. It used to be, back years ago, we would go in and we'd just go to the desk and leave the patient in there, and we'd talk to the nurse. She never laid her eyes on the patient at the time. She wasn't seeing what we were trying to tell her. So they changed it, and they are now made to do handoffs at bedside. So these surveys, assess the communication openness, supervisor expectation about safety, and organizational learning. And this is a fairly new thing for EMS. We've all heard of the Joint Commission, whether we've heard the Joint Commission is in the building over the intercom while we're in the hospital, or we've ever worked at the hospital and we just know that, Joint Commission's going to be there. They're making their rounds today. Make sure your cups are off the nurse's desk, stuff like that. They come around, and they are assessing, things that they can improve, how to make things safer, how to make things better. But they're getting reimbursed for that. They're working with the hospital, and the healthcare reform law that aided in hospital reimbursements. Provider payer collaborations are, these hospitals are getting money for these improvements. EMS, I couldn't find anything. I don't know if we are compensated for improvements, but it's a fairly new thing. So the EMS, I found on one website, it was the Centers for Patient Safety. Yeah, they actually work with the NHTSA. How many times have we heard that in the very first chapters of our EMT and paramedic books? We learned that, we're under the NHTSA, but they work with them for building this EMS safety culture survey. They have a whole website dedicated, and I actually couldn't find an actual survey from the Centers of Patient Safety, because it is a business that organizations can pay to conduct these surveys. And one thing that I found about that was that this business ensures the confidentiality of the people taking these surveys. There can't be any legal ramifications or reprimands for the things that they put on these surveys. So it's not like your supervisor's coming and handing it out to you saying, Kelly, fill this out, let me see what you say. It is an outside company coming in and doing this survey. And I think that helps with accuracy. So these surveys for EMS specifically, they're built using components from validated and psychometrically tested stops from the AHRQ. So they're still working with the AHRQ, but this is just kind of tailored towards EMS. The EMS survey specifically measures 12 critical areas of organizational culture of EMS. So the Centers of Patient Safety have gone in and they have assessed things